Right. So continuing on the topic of detoxification, what I actually wanted to touch on is the first phase of detoxification, which is we start with what we call a live blood analysis. So if a person comes into the clinic, the first thing that they need to do is a live blood analysis. I'll also recommend that persons actually do what they call a CBC, which is a complete blood count. That's to actually check your white cells, your red cells, things like your platelets. We look for if there's high levels of what you call basophils or eosinophils. That's to tell if a person have a parasitic infection, because we also do detoxification of parasites as well. Now, of course, in live blood tests, we generally see the actual parasites moving within the blood. So that's something that persons actually can do, especially those that are dealing with things like cancer. I always believe that persons with cancer tend to have some type of parasitic infection actually going on. If it is that they're not really feeling it, there should be maybe some types of parasites actually within the body. Right? So that's a little side note for persons to look into. Other than that, continue on detoxification. So the first step, you get that live blood test done, right, which can actually be booked in the 3 clinics. When you get that test done, either myself or Dr. Navarro or Mr. Diaz will actually go through that test with you, let you know what's going on. So we look for circulation, immune system, if there's any parasite, bacteria, fungus, anything affecting the liver, colon, kidneys. We'll also actually do, within that detoxification period, is where persons will actually do cleansing of the liver, the kidneys, the colon. And this is why we have so many different services actually at the clinic. For example, when a person want to detoxify the lymphatic system, we can do the soaking bed. We can actually do, which is like a sauna. We can also do basically the oxygen bath, which also stimulates the lymphatic system as well and helps it to drain. If persons are not able to come out, let's say come to the clinic, because there are persons who bedridden and they can't, let's say, come out of their homes, we do have certain home programs that they could actually do. It's always better to be supervised in any case.
Yeah.
But if they cannot come out, we do have programs that persons can actually take advantage of as well. So during the phase of detoxification, again, live blood. After that live blood, you start with your liver. You go down to basically things like your colon, which will also do what you call colon hydrotherapy, which works excellent for persons that have like back up within the colon. Especially, what I would say, anybody that eats a heavy